For most people, when they adopt a ketogenic diet or even low carb, they're going to tend to include more animal products and more saturated fat, which you've brought up a couple times. But I want to go deeper on that because that is a fear that could be a potential roadblock for a lot of people who over the years have heard saturated fat is going to cause, heart disease, heart attacks, strokes. Let's talk more about saturated fat specifically and put people's minds at ease. And again, as a cardiologist, you're the perfect person to do this.
Mm-hmm. Yeah, well, and the first thing I always have to start with is a keto diet is not one diet. It's any diet that lowers carbs enough to get you into the state of ketosis. You can do that with a vegan diet. You can do that with a vegetarian diet. You can do that with a Mediterranean diet, all low saturated fat. So by no means does it have to be a high saturated fat diet. Now, the way it's frequently thought of, and probably the majority of the people who practice a ketogenic diet do eat higher than recommended amounts of saturated fat. But again, you got to go back to what is the quality of the evidence that either red meat specifically or saturated fat is harmful for cardiovascular health. And if you're talking about general population studies, those studies that are observational studies that just follow people over 10 or 20 years, and they do a food frequency questionnaire 1, 2, 3 times at most during that 20-year period, right away you're dealing with very low quality evidence. And then how do they define saturated fat? Well, there's saturated fat in cookies and cakes, and baked goods. There's a burger, which includes the burger patty, but also the bun and also the ketchup, and usually associated with French fries and a sugary drink, right? So lasagna is a saturated fat, with so high sugar in the sauce and the noodle. So it is the messiest data you could possibly have. So to try and take that quality of data and then say the outcomes are meaningful, especially when there's also this concept of healthy user bias, which means when you look at the people who eat more saturated fat compared to less, the people who eat more exercise less, they tend to be less educated, they tend to smoke more, drink more alcohol, more likely to be overweight, eat more calories total. And it's not that the saturated fat caused them to be less educated or to not exercise. It's just how they are, right? So you factor in that bias that exists before the study even starts. So for any of that to have a meaningful outcome, there has to be a very significant difference in the cardiovascular outcome, in the who lives or dies early type of results. So people say, well, what about smoking? All those things are true about smoking. Yeah. And, the hazard ratio and odds ratio, meaning sort of the effect size seen in the studies for smoking, was like 15 or 20. Okay. And when you talk about red meat and saturated fat, it's 1.2, 1.3. Compare that to smoking 15 or 20. So when you talk about all those problems with this study, the studies in this very thin margins, it's essentially meaningless. So now we're talking about someone who's eating whole foods, low carb, they're metabolically healthy, they're eating saturated fat or red meat. Do we have any evidence that that's harmful whatsoever? The answer is no. We just don't have evidence that that's harmful in that type of situation. Now, the one caveat is if you look at saturated fat and you say, okay, LDL goes up significantly with saturated fat. That is one area where there is a higher risk of cardiovascular disease, still not near the 15 or 20 from smoking. But again, now we have to say, okay, in a metabolically healthy individual, does that make a difference? But again, you can measure for that. And in the majority of the people who start a ketogenic diet, high saturated fat or not, LDL does not go up in the majority of those people. So we should not assume that it's harmful. So as you peel away the onion, you start to see that really there's not much there. Now, I don't know, would that take me 5 minutes to explain as opposed to saying saturated fat's dangerous, boom, move on, right? It's a lot harder to kind of go through the nuance and talk about the details and the specifics. But when I'm seeing a patient in front of me, I want to know what's the effect for that person. What's going to happen to that person? Not what a 100,000 person population study shows that does not apply to this individual sitting in front of me at all. I want to know about the individual in front of me or me as an individual, right? Like I've certainly done a lot of my homework on this. I have no problem eating saturated fat. My metabolic health is excellent. My calcium score is 0, right? My blood pressure is perfect. Like, these are the things I'm following, not some perceived threat from saturated fat when there are things I can measure. And I know the data about saturated fat has nothing to do with me as an individual.
All right, well, let's add another layer onto saturated fat. Carnivore diet. Somebody totally eliminating plants. Likely saturated fat is going to be at another level. How do you feel about that diet in general?
Yeah, that's a good question. And this is somewhere where I've definitely evolved. I mean, I wrote a book, I don't know, 10 years ago, 5 years ago, somewhere around there. I don't even remember. And when I wrote the book, I was sort of like, yeah, you shouldn't be carnivore. You got to have half your plate full of vegetables and still low carb, right? But I was not a fan of the carnivore diet. But when I stopped to think about it, I'm like, well, why? Why am I concerned about the carnivore diet? And it's just because I've been taught forever, you need your fruits and vegetables, right? I got over the point that you need your healthy whole grains. So can I get over the point that you need your fruits and vegetables? And it's the same concept. Like, there's not one diet for everybody. Some people react very poorly to vegetables. That is true. I definitely stopped short of saying, everybody needs to avoid vegetables. Sure, you can talk about phytates and anti-nutrients, and those are all true to a degree, but that doesn't mean they're going to affect everybody. And large population studies showing healthy populations eating plenty of fruits and vegetables shows, it can't be that bad if they're, subsisting on those foods and still living healthily. But that's very different than saying everybody needs them and a diet without them is unhealthy. That is a different statement. And to see people change their lives on carnivore diets, to get rid of, whether it's abdominal bloating and just GI symptoms, or whether it's an actual inflammatory bowel condition or mental health. There are some people who went keto and saw some benefit, but didn't really thrive until they went carnivore. Like, all you have to see is a few examples of this and be like, wow, there's something there. Is it the elimination diet? Is it the more meat and the nutrients and the protein? Certainly we don't know because it hasn't been studied all that well. But there's clearly an area where a carnivore diet can be very beneficial for people and very healthy. I mean, again, you don't have to assume if it's going to be healthy or not. You can follow people's blood sugar and their insulin and their triglycerides and their calcium scores and their mental health and their, body composition. And there are so many objective things you can follow to say, is this healthy for me or not? You don't have to guess.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Metabolic dysfunction for a lot of doctors, and certainly the way I was trained, is whether or not you have type 2 diabetes. And if you're short of that, you're okay. Metabolic dysfunction, being metabolically unhealthy, starts at that early stage of insulin resistance when your body